Thank you.
Thank you, Hannah. Thank you for the introduction. So, welcome all, welcome one and all. I am the program lead for the MSc Advance Physiotherapy Practice, and I've been in this post for three to 4 years. For first year, I was kind of joining it up with sharing it with another staff, but now I've kind of come independent. So, just a bit about me. I am a lecturer at the university, and I did my PhD in this university actually in 2011. I started my PhD in 2011. I finished it in 2015, and after which I worked with the NHS for a good number of years, 6 years, I think, 5 to 6 years. And I was working with the research unit in orthopedics there, as well as working as a clinical physiotherapist. So my specialty is orthopedics and traumatology. I've done a lot of research in total hip and knee replacements, physical activity levels, so on and so forth. I love back rehab, spine rehab, knee, as well as shoulder rehab. So you kind of know that I'm an MSK budding professional with what I'm saying, if you know what I mean. I do a lot of publications as well. I work with the dissertation students. I've got a few students under my belt, and I once they finish that, I kind of try to publish their work. So, and I teach you guys the MSc Advancing Physiotherapy, potentially you guys who are going to join. I teach you guys MSK as well as one of the core modules, and I teach the undergraduates as well as the MScs as well, and I supervise PhD students as well. So I've got a lot on my plate. So that's me. Enough about me. What's about the university? So welcome to UGCU. So potentially you will be joining our university, which is a really good place to study. It's one of the top 40 universities in the UK, and it's one of the top universities in Scotland for HP education, which includes physiotherapy, occupational paramedicine, dietetics, ophthalmology, radiology, so on. We've got around 22,000 plus students and from 120 nationalities. So it's quite diverse, multicultural university. You'll find a lot of good people around here who you'll be able to interact from your own community as well. And we are well within the city center. We just smack right in the center of the city center. Just opposite our campus is the bus stand, the Buchanan bus station, which takes you to outer Glasgow and into the city as well. And so it's quite accessible, and you get a lot of good things in GCU as well. And obviously, we live in Scotland, which is affordable. Living is affordable, and it's quite inclusive. I must say, I've been living here for the past 20 odd years, and I have not. I missed India. I am from India originally. I did miss India, but now Scotland's home for me. So that's about GCU, and also a little bit about Scotland. So there's lots of things which you can do in and around Scotland. You see a few pictures which are put up here. Sports enthusiasts, you can see the Hampden Park. We've got a major football crazy community here, the Rangers and the Celtic. And if you are into football, yeah, it's the right place to be. A lovely botanic gardens you see there, and then you see the castle as well, the Edinburgh Castle, and that's kind of our I think that's the one of the military tattoos sessions going on there. And then you see the street there is Buchanan Street, just right outside our university, and that's where the major shopping hub is as well. So that's to do with Scotland. So you have lots of things to do here. So mainly, why are you here? Basically, to know about what we have to offer about physiotherapy and paramedicine. So the particular program which you have applied for or potentially going to get into is part of the physiotherapy department, and we have four programs here: two undergraduate and uh, four postgraduate, and one of it is yours. So we've got four well-renowned, world-renowned professors who work here within our department. Professor Sebastian Chastin Lorna Paul, Professor Don Skelton, and Professor Fred Van Wyk. Each of them have their own specialities. If you want, Google them up. Seb has the highest cited papers in the whole world with regard to physical activity. Laura Paul, she leads the MS team here, and she's got a lot of research under her belt. Don Skelton is another world-renowned specialist in geriatrics, and Fred Van Wyk is a leading author and voice in stroke rehabilitation in the world. So we've got all of them under our belt at GCU. So that is about a few things about the department. With regard to the actual program, you've got the core program, which is based on clinical reasoning and evidence-based problem-solving activities. So I must say at the outset, we do not do any practical sessions. We do not have any clinical placements as such. None of the universities in UK have clinical placements. So this is more for a practice or a seasoned physiotherapist. You've already a physios by profession. You're coming here to advance your knowledge. So we base our modules on clinical reasoning and evidence-based practice, and we do that by blended learning, that is by facilitated learning. So I will talk about that a bit later. So it's a one-year program. It starts in September for the full-time cohort, and we have a very healthy numbers joining our team, and which is kind of quite satisfactory, because we are one of the highest physiotherapy intake universities in the UK. So we've got around, we had around 124 2 years back. We had 94 last year, and we have 92 this year. And I'm not sure how many we're going to have from your batch. So we also have a lot of extracurricular activities, which is both academic and non-academic. We have the GC Society, which will help you. Also, we have non-academic activities, such as we do a lot of professional development series, which will help you in your career if you are planning to stay back here. For one example, we do a series on HCPC registration. We are not part of the HCPC team, that is the Healthcare Professionals Council team, but we aid in helping you get to the right point so that your application is easier. And most of our students, or anecdotal evidence, around 60% or so of our students find jobs either in the public sector or private sector, and most of them go back home. A few of them go back home and settle down back home in their own home countries and set up shop, and they get paid quite well. And a few of them go back to the Middle East as well, and they get paid there as well. So there are lots of options for you, which will open up after you've done your program with us. So the requirements as such, as you can see, this is available on the website. You can see that you need a UK honors equivalent of 2:2 in physiotherapy. Alternatively, you can get an unclassified degree, but obviously that will depend on how much professional experience you've got, and that will depend on us scrutinizing your experience and seeing if you are good enough to fit into our program. And the main thing is you need to have an academic IELTS of 6.5 with no single element less than 6 for your English language tests. This is a must and a mandatory thing, and without that you will not be able to get admissions here. The fees is again put up there. This is the latest fees for mostly your international students. So your fees will be £16,200. So what doesn't the program offer? This is something which I need to emphasize. A lot of your contemporaries and previous batchmates have come to me asking for clinical placements. And as I said, we do not have clinical placements. We do not offer clinical placements. It's more clinical reasoning and evidence-based modules which we have. Since you're already physios, we do understand that you have that skill set required to be a proper eligible physio here in the UK as well. We'll train you with the reasoning and the evidence which is required. Having said that, during your modules, we have specialized MSK modules, neurology modules, which we do have some practical elements within embedded within the module, which will help you learn about assessments and treatments as such. So there is a bit of it, but it is more anecdotal, and it is more case study based, and it is more within the module. You do not go to an actual hospital to have clinical placements. And also, we do not have any professional UK accreditation, as in CSP and HCPC do not accredit any of the programs, the post-registration programs with us. The pre-registration, that is the undergraduate programs, are double accredited, but the post-registration we don't, because this is offered to physiotherapists who this is offered to students who are already physiotherapists. So there is quite a number of good feedback, graduate feedback, that physiotherapists who are at the early and mid stage of their career benefit quite a bit from our program. So how does the program structure look like? So we've got three trimesters. Trimester A, which starts in September, finishes in December. Trimester B from end of Jan to April. And then trimester C, which starts in May and finishes in July, August. So trimester A is when you'll have your core modules taught. There are 2 core modules and each of them are 30 credit. So that's in trimester A. And trimester B is when you have all your optional modules, which you'll be covering. And trimester C is when you'll be doing your final dissertation, which is 60 credits in length. So what are these modules? So trimester A, you have your core modules, which are the research module, advanced research methods, and advancing professional practice. These are mandatory modules. You must do it. And without these modules, you cannot pass out as a advanced physiotherapist degree as such, the MSc one. So, and also remember, advanced research methods is mandatory for you to do a dissertation. Without passing this module, you cannot go into a dissertation. And without finishing advancing professional practice, you cannot get your named degree. I must also intervene and say that I teach on the advancing professional practice module for you guys when you come in. So what happens in Tri B? As I said, this is for optional modules, and these are the optional modules which are given out this year. So we have advancing MSK practice. I teach on that again. And we've got advanced practice in neurological rehabilitation. Then we've got human movement and MSK rehabilitation. This is basically not similar to the advancing MSK practice, but this is more biomechanics based. And then we've got advanced leadership in health and social care practitioners module. Then we've got 15 credit modules which are combined together. You need to take these modules as they look like. You cannot interchange these modules because the teaching patterns will change if you interchange it. So you need to take it as they are. So applied pathophysiology and advancing professional practice, which is 15 credits, added with supporting anticipatory care is another 15 credit. Then we've got a diabetic based modules, which is lower limb for foot and care and diabetes, and nutrition and lifestyle management and diabetes. Both are 15 credits, has to be taken together. And finally, we've got social action and approaches in public health and infection prevention control in global context, which is again a 15 credit module. So what you see here is you've got slots as well. So it's kind of limited. The finite numbers are associated with the first 4 modules at least. And also for the other modules, you need to have a minimum number of intake for them to run that particular year. Yeah. So with regard to these selections, you do not do them right now. You come into the university, you settle down, and the end of trimester A is when you will be choosing these modules. So do not choose your modules beforehand when you register for the program. So that is something which you need to take to heart. Because there are certain students who do it right now and then come back and then later on ask me for the same modules, but obviously they are not counted. It's only counted after you get more information about these modules when you join the program. So that is these are the optional modules. And then you go on to what are the study options you get. So you can exit at any point. You have a 60 credit PG certificate. If you get 60 credits, you can go out with a PG certificate. And if you get PG, if you get 120 credits, you are eligible to get a PG diploma. And obviously an MSc is 180 credits. And the MSc is where you have to complete your 180 credits to be eligible for your post-study work visa if you are an international student. And also you need to do these mandatory modules, ARM, let's repeat there, ARM, APP, and dissertation. ARM is the research module, which is mandatory for you to pass before you go into your dissertation. And each module you get 2 attempts, that is Diet 1 and Diet 2, within which you need to complete your program with your module. I'm sorry. So what are the teaching modes or methods we use? We use a lot of blended learning and teaching. You're all mature students, so we won't spoon feed you. it's kind of facilitated learning, so you need to be prepared before you come into your classes. There's a lot of pre-reading which you need to complete before you come, and then we facilitate concepts in your classes. That is how blended learning and teaching occurs. And we use a mixed method. There's a lot of peer teaching, there's a lot of group learning, there's a lot of simulated learning, case study learning, so on and so forth. And most of your lectures are on campus. There may be a few which are online as well, which are integrated with other departments. And you obviously get to meetings with your tutors and supervisors and program leads. It can be done online or in person via MS Teams. And so just a bit about our university. This is the top ranking university for the past 3 years running, 22, 23, as 12, 24, according to the Good University Guide. And Good Times Sunday University Guide, we've got the first rank again for last year. So you know that we are doing quite a bit of work here, and we don't have to boast about ourselves, but anecdotally you will hear from a lot of your contemporaries and peers who have already joined here that we do a good amount of work. So we have a few links here which will talk to you about what we have been doing here and how to set you up as an international student, as well as what to expect in a master's degree. And there are quite a few positive reviews for our university as well as our department. These slides will be shared to you, so you can go in and have a nosy. And these are a few anecdotes which I pulled out, which you can read at your leisure as well. And then if you have any further questions, that is the email you need to use. And there's the handles as well, which you can use, the social media handles, which you can use as well. Just take a note of that particular email, and that's handled by me personally. So if you have any questions directed towards the program, or you want to learn more, just email this. And also please hand this over or pass this over to other potential students who may want to do the same program, who are not here just now, so they will also benefit from this. And that's my presentation done, and I'm open for questions.
Thank you so much, Artaban. I've just popped a message in the chat there, but please feel free to ask any questions while you've got Artaban here online. Obviously, alternatively, there is his email address, but this is a really good opportunity to ask anything you may want to know. We'll just leave it a couple of minutes, Artaban, and if a few questions, then great. And if not, then we will be able to send out the recording in due course, but I'll just pop back on mute just in case any questions come in.
It looks like they've got all the information they need.
I know it is possible. To be fair, we have this round of webinars is quite early in the cycle. Mm-hmm. Oh, there's one. Can you see that, Artaban?
Not yet.
It's just in the main. It's not in the Q&A. It's just in the main public chat.
Yeah, I can see that. May I know the APP program is suitable for which level of NHS PT? So it is eligible for all levels. Hi, Mohammed Sirajuddin. Thank you for your question. We don't have a kind of a suitability as such for an NHS PT. So we have band 8s, which is the highest level. We have band 7s, band 6s, and 5s who join from the home crowd to do this program. So anybody can join. So there is no particular matching of grades with who have to enter here. But a minimum entry would be a band 5, that is a physiotherapist with at least who's fresh out of university or has at least a year of experience. That is what we would expect from here. But from the international side, we have criteria which I put up as well. So there is no particular level which we match the MSc at. That's the answer for you, Mohammed Sirajuddin. Any more questions? On what basis the option modules can be elected? Any specific criteria? It's your choice, Shamant Somanna. So it's your choice. So you can potentially, depends on what your interests are. So that is why when you come into the university, we will give you more information about specific modules. The module leads would come out and give you a chat, give a chat about what these modules stand for and how you can utilize. For example, you may be an experienced MSK specialist and you may not want to do that MSK module. You may want to do something different. But if you are a budding MSK specialist and you want to learn more, then maybe MSK is a good thing. And you got MSK and human movement. So there are two different modules. One talks about spinal rehab alone. The other one talks about biomechanical rehab, how you can use biomechanics to analyze and how that can help your interventions. So that is the difference. Neurology is a different kettle of fish altogether. It has both pediatric as well as neuro, and what is currently needed in this particular day and age. The contemporary ones are contemporary topics are always taught. So that is how it is used. Or if you are actually quite experienced in all the particular fields and you want to do something specific and something which is different, then you can choose those 15 credit modules which I was talking about. The diabetic modules in this day and age is quite essential. So they'll teach you about how to manage diabetic care. You'll only not have physios, but you'll have podiatrists, you'll have other specialities joining into those to do those modules. So in that case, you learn a lot more. And or if you are kind of a generic physio, you want to do more public health, then you can go into social care stuff. So it all depends on what you want to do. So that's basically the criteria. So you need to choose what you want to do, but you need to stick to only 2 modules, or if you're choosing 15 credit modules, it should make up 30 credits. So that is how it is. And Mohammed, you haven't asked another question. The program accredited by MACP if you take, no, it's not accredited by MACP if you take the MSK course. It's not. Hannah, I think that's a question for you.
Yeah. So Amel, I'm just having a look. So you've got a conditional offer concerning IELTS. So if you've got your IELTS, you could immediately join the university. So yes, if your conditional offer is only based on IELTS and IELTS alone, so if you don't have any other conditions on your conditional offer, then yes, should you satisfy the IELTS requirement, then you would then be kind of uprated to an unconditional offer. And that would give you the option to join the course in September. So yes, in order to answer your question, as long as you can meet the IELTS requirement, you would receive an unconditional offer for the programme, as long as there were no other conditions. Hope that helps. Any other questions? Or are we all okay? If that's the case, then I think Artaban,
thank you,
we can wrap things up. Just to let everyone know, we will likely run another kind of webinar series. Oh, sorry, one more question.
So Rivi, the CSP have doing a program. We are doing a program review right now for all our programs. So every 5 years we do something called a review. So we were planning to get accreditation for our program this particular year for the MSc, but the CSP as a blanket, they have decided to put a hold on it, in the sense they're planning to stop all the accreditations. I think we do have accreditations for certain universities, I think 4 universities in the UK. So all of them are put on hold because they want to review what criteria they want to look at and how they want to do the accreditation, or if accreditation is at all necessary for post-registration programs. It is definitely necessary for pre-registration programs because that's where you become a physiotherapist. But post-registration programs, you already are a physiotherapist. So why do you need accreditation? That is a question mark. So if you are going into some specialty, like if you're going to do first contact practitioners, or if you're going into some advanced roles, then there may be specific accreditation fitted within that role, which does not cover the program or the university's program. So that is the reason why they're revisiting their strategy as to how to go about doing this. And Chinese whispers, if you know what I mean, is that they may stop accreditation as a whole for the whole of UK for all the post-registration programs. In that case, you don't need accreditation at all as such for any university you join, including ours. I hope that made sense, Riddhi. Okay. Any more questions?
Any more? I'm always listening to say it, and then another one will come in, no doubt. There we go.
Does advanced clinical practitioner competency is met by the APP program? Can you elaborate on that question, Mohammed? So do you mean to become an advanced clinical practitioner, do you need the APP program? Is that what you mean? Right. No, you don't. So the MSc is a standalone. The MSc APP program, which you are about to venture into, is a standalone program. It is not affiliated with any of the degrees. So you don't need the MSc APP to become an advanced clinical practitioner. But if your employer requires a master's in any degree, any field, then there's a different kettle of fish. So this question needs to be addressed by your employer, who is going to give you that particular role. But as per our role, a lot of advanced clinical practitioners, they come into our program to do certain modules, whether they require it for their role or to practice or to kind of get a higher degree, higher staffing or higher grade in their profession, is the question which the employer has to ask. But anecdotally, we've seen a lot of, we have a part-time version of it, which is zoned in for the home crowd. And we've got another program which is similar to us. It's called the Advancing Practice, which has several pathways. A lot of our physios who practice in this country, in Scotland, they join that program for standalone modules because they require those standalone modules to jump up a grade or to get better at what they're doing. So, but that is not dictated by us. That's dictated by the employer. So to answer your question, there's not a requirement, but if you want to, then you'd have to go through your employer to see if you require it.
Artaban, just to say, there's another question that's just been popped in the Q&A box.
Yeah, I'm going back there.
Yep.
Different treatment options will be included in the course. I mean, dry needling, etc. Not dry needling. Amal, thank you for that question. Not dry needling as such. We will not do that. Those are all standalone CPD courses, which doesn't need a full MSc to go into. We do a generic MSK based back module, which is covered. We cover the whole of the back. We do Pilates. We kind of touch about a bit about Pilates, and we cover about all other particular interventions which are used, but we do not specify and go into one. We all use evidence base here. So there is evidence that needling may or may not work. So why do you want to go in to do needling if it doesn't work? So what is the right evidence which is used? So there may be evidence to state that McKenzie's may work. There may be evidence to state that Mulligan's may work. There may be evidence to state that Maitland's may work. So we go by the evidence to find out which is the most appropriate treatment for that particular problem, and make sure that you understand the clinical reasoning behind it. So there may be n number of treatments, but we do not specialize in any one treatment. Okay, we give you the information as to what is required and how you go about doing it, and then how you use clinical reasoning to come to that particular assumption as to which is required. So the specifics of the needling, specifics, you need to go and do a standalone program for that. It's not covered in the university program. Is that clear, Amel?
There's one more back in the main chat, Artaban.
Coming back.
Related. Two
Sriram,
more.
Akshara Sriram, are Indian certificates on dry needling manual therapy valid in the UK? That is not a question for this particular forum, but it all depends on where you apply to. If you go into the private sector, they may take it in, but in the public sector, the NHS, they don't use dry needling or any kind of manual therapy. They do manual therapy, but not I think the one you mean is here high velocity, low amplitude, or spinal manipulation is what you're talking about. Those are all used in the private sector. So it's not kind of a question for this particular forum. So I think you may have to ask your employer that. What is covered in Advanced Professional Practice core? Advanced Professional Practice is the APP module, which covers, within the NHS, there are 4 pillars of practice. There's the clinical pillar, leadership pillar, facilitation of learning pillar, and research pillar. So these are the 4 pillars which make up a proper physiotherapist. So a physiotherapist needs to know about each bit of it. So what happens in advancing professional practice is that we teach you as to where you stand within these pillars and what is required for you to improve yourself as a physiotherapist. Do you need to improve your clinical side of it? Do you need to improve your leadership side of it? Do you need to improve your facilitation of learning side of it? Or do you need to improve your research side of it? How do you go about mapping yourself within that particular 4 pillars of practice? And how well do you improve yourself, or what are your strengths and weaknesses? How do you identify that? So that self-learning, self-realization, and self-assessment is what is done, and we evaluate you on it. That is what is advancing professional practice. And advancing MSK practice is completely clinical. It's all about the spine. It's all about your cervical section, thoracic, lumbar assessments and treatment modalities which are needed. SI joint, which is the assessment and treatment modalities available. Whiplash injuries, we talk about outcome measures, we talk about Pilates, we talk about pain pathology, we talk about muscle pathology, and how you can use what are different, like, what are slow twitch fibers and fast twitch fibers. If each of it is affected, how do you go about treating it? What is your exercise prescription? What do you need for exercise prescription? How do you utilize the FITS principle? All that is covered in your AMSK. So the core module is more to do with your general physio-based stuff, and you and a lot of other professions also join in that particular module. But for your specializing AMSK module, it's all to do with your clinical stuff, which you learn at a higher level, that is clinical reasoning level. Is that clear, Mohammed? Amal, thank you so much. Excited to be joining. Well, welcome. You'll be seeing my face for the next 1 year then. Sweeta Pandey, hi. Hello, Sweeta Pandey, hi. Okay, Mohammed, thank you for that.
I feel like Sweeta might follow up with a question.
Probably. So I assume most of the guys in the forum have already planning to join GCU. Hannah, is that the case?
Yep, so the invitation to this webinar went out to all of the applicants and offer holders. Okay. So there'll be a mix. Oh.
No, Sweeta, that is what I was covering in my presentation. We do not have clinical placements at all. We can kind of guide you or direct you or signpost you to where placements are available. but those placements are usually for pre-registration students. You're already a physiotherapist. You do not require placements to go in and start from scratch. Those placements are for pre-registration students. For you, you'll require something called a shadowing experience or a volunteering experience. So that you need to do on your own. However, we will be able to tell you where to go, but it's your responsibility to find it. It is not our responsibility as a university to get you those placements. And a lot of our students currently and previously have gone ahead and got volunteering jobs, or they've gotten themselves shadowing gigs just by approaching different sectors. So a lot of them go into the healthcare support working sectors, where they enter the kind of the healthcare realm, where they can at least learn about what's happening, how things are done, so on and so forth. And from there, they jump into physio roles if they want to. And remember, if you're hard to go and see a patient or touch a patient, you should have your HCPC registration with you. Without that, you cannot. None of the hospitals will take you in without HCPC registration, even for a shadowing gig. I correlate advancing the practice core as one of the competency skills for. Okay, Sirajuddin, good, noted. Okay.
Perfect. Is that us? Any last questions for Artaban?
You're a lively crowd with a lot of questions, so I'm happy about that.
I know, very engaged. Is that us? I think that might be us. So just to recap, everyone, obviously you can see on that final slide from Artaban, there's an email address for you to get in touch directly with him. And we've also got the social media channels there, so feel free to follow. This webinar has been recorded, so it will be sent out, so you'll be able to go back and listen again and gather all the information you need to make an informed choice about joining us in September. We will be running more webinars throughout the course of the cycle. Obviously, recognise that this is quite early in the cycle, so you'll get the chance to engage with Artaban again, and maybe delve into a bit more kind of specifics about what to expect when you come to join us. But we really hope to see you in September. And yes, enjoy the rest of your day. Thank you so much to Artaban for giving up his time and for delivering such an insightful presentation. And